I can literally see God's grace and mercy and compassion in action at the Church Health Center. And of course, it's made me a much stronger person on every level.
Church Health, I would describe it as like my second home because I truly feel all the love and care and that I receive from here. Everyone is so nice and supported.
The people is awesome. I'm talking about the people is awesome. Everybody have a good spirit.
You know, I had a dream of being a physician since I was a child, but it wasn't until I came to Church Health and I saw the physicians here really impact people in an underserved community. And that has always stuck with me. Really taking time to really care for people as a whole and not just looking at them as, just another number.
Anyone can open up a clinic somewhere. There's something different about what we are doing. And I think it's because of the intention behind the why. Why are we doing this? Why are we taking care of our neighbor? Why are we coming together to do this work? And it comes from a deeper, more meaningful place than just delivering healthcare.
One of the things that stands out to me the most is really being inspired by Scott Morris talking about his passion for wanting to help the underserved. And he felt like he could do the most good here. And that has been one of the things that has resonated with me all these years later as a physician myself.
I read somewhere that Memphis is the poorest major city in America. And based on that, I said I was going to Memphis. I believed then, as I do now, that people of faith have an obligation to do two things: to care for our bodies as well as our spirits, and to care for the poor when they are sick. And I think that's true whether you're Christian, Jewish, Muslim, Hindu. Every world religion really has the same concept, that this is what God expects of us.
The Church Health Center may have the name church in it, but it's the most Jewish place I know in terms of values, in terms of its compassion, in terms of its impact and making a difference in the lives. If you think about it, over 35 years, if you do the math, it's as many people as live in Memphis have been impacted by Church Health.
I think that's what God's called us to do, to care for each other. And not just to bring a meal or not just to pray for somebody, but to care in every way we can. And when I get to help a person at Church Health, in that kind of environment, it'll stick with me.
The impact in the city is to fill a great gap, but I think the more important gap is in people's lives, that they feel respected and loved here, and that Church Health is addressing not just what's wrong with them and that makes them feel bad physically, but the key and the magic here is the whole person care.
Scott and Church Health have played a pivotal role in advocating for the kinds of supports for people who are in poverty and the kind of health care that they need. And I wouldn't presume to know what's in the future of Church Health, but I do know that it will be responsive to the real needs of people.
I see Church Health as a small tree, started back from 1987, and now as time goes by, it's become a larger tree. And the leaves represent us, like the volunteer providers, our doctors, our interns, our scholars, our technicians, our nursing, everyone just work together and just create that tree,
Church Health was always about finding ways for the faith community to do what God has called us to do. Care for our bodies as well as our spirits, and to care for the poor when they were sick. This is what our mission has always been. We have not wavered for that, and we're going to keep doing it for a long time to come.